Welcome to RelapsePreventionPlan.net's free online rehab lessons. We believe that it's never too late to learn to prevent relapse. Welcome to this presentation on changing your view of your world. In this presentation, you will learn to describe what evidence-based information means. You'll learn to define probability and list 2 effective ways to make decisions, and to describe the importance of paying attention to learning and change. So, how do we decide what to include in the lessons? The skills we teach are evidence-based. Evidence-based means the skills were tested and proven effective by reputable, well-known, and trusted sources. So, what are reliable sources? The sources are institutions like universities or individuals who are acknowledged experts in the field. The studies used generally accepted scientific methods to carry out their research, and the research has been reviewed and proven by other experts too. The studies have shown repeatedly that relapse prevention tools and coping skills actually work when individuals learn and apply them diligently. So what does evidence-based mean for you? What this means for you is that if you complete the workbook and apply what you have learned, you will have the best chance to prevent relapse. So, how do you decide what information to use to change your life? Each person who completes these online lessons decides what information they will use to achieve their life goals and to maintain abstinence. What have you decided to use from the lessons you have completed? People with the experience of addiction tend to make decisions based on feelings rather than facts, impulsively rather than reflecting for a few minutes to a few days, and based on short-term gain rather than what will improve their life weeks, months, or even years from now. What do you believe and what do you know about addiction? Some people assess what happened to them and others in the past and make predictions about the future benefit of staying clean, learning skills, or changing their life. It is very important that you learn to make good decisions about what actions to take to end your experience of addiction. So, how to make decisions? Number 1, base your actions on research, numbers, and past patterns, such as the number of people who relapsed after attending a certain type of program could predict the probability of a relapse for you in the future if you attend that same program. Would feelings or beliefs be more valid than numbers and projections? Number 2, base decisions on subjective or personal degrees of belief about the future, such as bad things come in threes or good things come in threes. I relapsed 3 times, so now I'm finished relapsing. And I have a bad feeling about going, so I won't go. Let others or the universe decide. Number 3, believe the future cannot be predicted or changed. What happens is fate or predestined. Whether I stop using or not is not controlled by me. If it's going to happen, it will happen. I am what I am. Or avoid making a decision. Number 4, when in doubt, don't make a decision. Avoid making any decisions by using distorted thinking, such as shoulds and ought tos. I shouldn't have to choose between more money and less fun. Procrastinating and saying you will decide next week. Waiting for more and more information. An economist is an expert who will know tomorrow why the things he predicted yesterday didn't happen today. Beliefs about addiction can affect the type of relapse prevention training. Relapse prevention programs are built on belief systems as well as the evidence. What you are prepared to learn and to change in your life is influenced by your beliefs about addiction as well as the program you attend. Addiction was originally considered a sin. Programs that use the moral model believe people are individually responsible for behavior, good behavior should be praised, bad behavior should be punished, and using is morally wrong. Take out a piece of paper and write down your ideas about the moral model. Hit pause on the presentation if you need more time. Later addiction programs were based on a scientific model. Programs that use the disease model believe addiction is caused by genetic and biological factors. Addiction is considered an incurable progressive disease. People have no power or capacity to change their behaviors, and many require medication. Take that piece of paper out again and write down your ideas about the scientific or disease model. Pause the presentation if you need more time. As the understanding of addiction advanced, so did the programs to treat it. Programs that use a behavioral model believe addiction has multiple components. Habit formation and habit change are primarily influenced by cognitive and behavioral principles. Cognitive behavior therapy was developed and used in these programs. Write down your ideas about the behavioral model. The newest programs are holistic and evidence-based. Programs that use evidence believe improving physical and mental health is part of ending addiction. A complex set of factors cause relapse, so an approach using multiple tools is required. Programs need to have multiple tools because individuals have unique characteristics, needs, strengths, and risks arising from gender, age, life experiences, genes, and cultural identity. Write down your ideas about the evidence-based model. Again, pause if you need more time. So, how will you make decisions now? There are days you will think about giving up. There are facts you will hear that you may not want to believe. There are times that people will try to convince you to take certain actions. So it's time to begin thinking about how you make the big and small decisions and how you can improve your decision making. All over the place, from the popular culture to the propaganda system, there is constant pressure to make people feel that they are helpless, that the only role they can have is to ratify decisions and to consume. So, to what extent does your past determine your future? We cannot quantify the future because it is not known. We use numbers to examine what happened in the past and try to predict the future. So, to what degree should you rely on the patterns of the past to tell you what your future will be like after experiencing addiction? Which matters more when facing a relapse risk? The facts as we see them, our subjective belief, or can we use both approaches? Using hard facts to make choices. 50% of alcoholics have alcoholism in their family. Of those who have familial alcoholism, 90% have 2 or more relatives who are alcoholic. Familial alcoholism tends to be particularly severe. Whether any person who is addicted to alcohol can ever return to normal drinking is the subject of controversy, but the probability is particularly remote when it comes to familial alcoholism. After finishing relapse prevention training, what should they do? What should you do? Based on the facts on the previous slide, do you think it would be wise for a person who is addicted to alcohol and who had alcoholism in their family to try reduce drinking after detox instead of maintaining abstinence? Take out your piece of paper and write down your answer. How will you make decisions? Number 1, fact. Each day that a person succeeds in maintaining abstinence greatly improves the probability of success after quitting. So, would you advise yourself or someone else to leave rehab early or to give up on quitting? Number 2, fact. After 5 years of sobriety, the risk of having a relapse is about the same as the risk for someone in the general population experiencing addiction in the first place. How long would you advise staying abstinent after quitting? Take out your paper and write down your answers. Pause if you need more time to complete. Good plans shape good decisions. That's why good planning helps to make elusive dreams come true. Using probability is important to managing the risk of relapse. We can't know about the future for certain. Numbers are tools to help us determine probability. Assessing the probability of a particular outcome helps us to determine risk. We all need to assess risk to make good decisions. Taking risks or daring to relapse. The word risk derives from the early Italian risicare, which means to dare. And I'm not sure if I've pronounced that correctly or not. But that doesn't matter because in this sense, risk is a choice rather than a fate. The actions we dare to take depend on how free we perceive ourselves to make certain choices. Probability and risk came into being as ideas in the 1600s. Probability came to be defined as with the appearance of truth. By the end of the 17th century, mathematical tools were developed to begin estimating the probability of an event happening or not happening. Tools were first developed to assist rich men and those men who wanted to get rich by gambling. Making decisions based on probability and sampling. Sampling is the process of selecting a representative group. We all have decisions to make based on limited data. George Bush needed just a few bites of broccoli to decide that it was not for him. Most critical decisions would be impossible without sampling. The doctor cannot draw all your blood before deciding on what medicine to prescribe. Sampling is essential to risk-taking. We constantly use samples of the present and the past to guess the future. Values influence whether we take action on information. Researchers found that people respond more to warnings about the probability of the sun's effect on their appearance than to warnings about the probability of cancer from sun exposure. Because it appealed to their values, people were more likely to use sun protection after watching a videotape about how sun exposure causes wrinkles and age spots, and seeing in a UV photograph how the sun had already damaged their faces. Information reduces uncertainty. If everything is a matter of luck, risk management, such as trying to reduce the probability of relapse, is useless. Invoking luck obscures truth and responsibility for actions because it separates an event from its cause. For example, It was just bad luck I started drinking again. Reducing risk increases the probability you will succeed. The essence of risk management is maximizing the areas where we have some control over the outcome, minimizing the areas where we have absolutely no control over the outcome and the cause and effect is hidden from us. When our world was created, nobody remembered to include certainty. We are never certain. We are always ignorant to some degree. So information is very important to reduce your risk. Probabilities can be used to guide some decisions, such as reducing the risk of relapse, avoiding STDs or pregnancy. So improve your decision making. In your personal life, you can improve your decision making by becoming informed. Use the information you learn in these online lessons to improve your decision making. Balance how you use information. Start using information to guide your risk reduction and relapse prevention planning. Don't let the information scare you or prevent you from trying. All predictive health data is about groups of people. There is no evidence that says you as an individual must be the one who relapses. There is no data that has the power to predict the outcome for a specific individual who has quit. Always use information to reduce your risk, and never as an excuse not to try to succeed. Learning to think and behave differently. The challenge of changing your behavior lies in obtaining and using valid information on the behaviors and actions that will increase the probability you will succeed, the behaviors and actions that will decrease the probability you will not. Addiction is a complex experience. Changing how you see your world. Use the information in these online lessons to challenge your view of your world, develop more accurate views of your world, take control over what you can. You can change your future. Preventing relapse is about using information to change yourself, your beliefs, and your actions. You can succeed in spite of any odds if you plan your actions to reduce risk and increase your probability of success. Luck has nothing to do with it. You will need to continue gathering and using information after you finish these lessons. Remember, preventing relapse is about ensuring you have a picture of your world that is as accurate as possible. Assess the reasons you used or did not use the online lessons information. Identify your positive reasons for using, and you can learn ways to achieve those outcomes without drugs or alcohol. Anxiety and depression are common in people with the experience of addiction, so self-assessment is a good place to start. Creating positive physical activity habits will change your life. You can leave addiction behind by developing values, attitudes, beliefs, and activities that are incompatible with intoxication. Maintaining improvement and making a skill permanent requires the slow, steady work that forms new brain connections. Use relabel, reattribute, refocus, and revalue to end obsessive thoughts and cravings and urges. You can find these tools in the Feeling Good Handbook by Dr. David Burns. Information and experiences can change your brain and your life. The brain is plastic. That means it can change and become more efficient during learning a new sport such as basketball, learning a new skill such as driving or playing piano, learning a mental skill such as a new language, and relearning skills after an illness, such as a stroke or addiction. Paying attention is key to change. Changes in the brain happen only when the new behaviors are specifically attended to. Physical changes in the brain depend on a mental state in the mind called the state called attention. Paying attention matters. It matters for the brain's ability to remake itself and become efficient at carrying out any new task, mental or physical. When you focus, your brain knows what is important. You can find the original research for this presentation on this slide and the next. Pause the presentation if you'd like to write any down to do your own further research. In this presentation, you learned to describe what evidence-based information means. You learned to define probability and list 2 effective ways to make decisions. And you learned to describe the importance of paying attention to learning and change. If you haven't already, please visit relapsepreventionplan.net and download our free book, Make Your Last Relapse the Last. Remember, this video is not a substitute for proper medical care and consultation with your physician. Don't ignore professional advice or delay seeking treatment based on this information in the video or on this YouTube channel. Thank you for joining us. You can do it. We believe in you, so don't give up.